your health tonight. Diseases that strike in the summer. Legionnaires' disease is one of these diseases. New York City has seen a spike. 7 people have died so far. News 4's Jen Sean spoke to the Erie County Health Commissioner about how the disease could impact Western New York. Jen?
Well, Melina, Legionnaires affects the lungs and tends to show up more during wet summers, and we've certainly had one here in Western New York. The symptoms include fever, cough, chills, and muscle aches. Now, the disease isn't spread from person to person, but rather via water droplets from faucets, air conditioners, showers, whirlpools, or cooling towers. In 2013, when Western New York experienced a lot of summer rain, there were 108 cases in Erie County. Last year, there were just 63, and this year, there have been 35 so far. Dr. Gale Burstein, the Erie County Health Commissioner, isn't concerned New York City's outbreak will affect us here, but says the spike is a good reminder to pay attention to the elderly and the very young during the summer months. Legionnaires tends to affect them the most. Now, the 7 who died in New York City were all older patients.
They usually develop pneumonia, and it can be pretty serious infection, although it is treatable with antibiotics, so it is curable, but you have to be able to diagnose it.
Now, according to reports, the outbreak in New York City was traced back to cooling towers, which released a mist where the Legionella bacteria actually grew. Other disease Burstein says show up more in the summer are rabies, Lyme disease, ticks, and West Nile. But she says there hasn't been a spike of any of them in Erie County so far. Reporting live in the studio tonight, Jen Sean, News 4 at 5:30.